My name is Christine Alvarez. I'm the Chief Clinical Officer of Adult Services at Alaska Behavioral Health. Recovery is the process of change where someone can improve their life through their own self-direction, where they're achieving health and wellness and really being able to function well in life. In our continuum, we serve a wide range of individuals in various processes of recovery. At our outpatient clinic, we provide I would say a pretty wide range of services. So when an individual comes and they're scheduled for an intake appointment, and that's really to assess where they are, what their needs are. At that point, we talk about, do they want to engage in psychotherapy, which is really a discussion with a clinician and setting treatment goals for what they'd like to accomplish and how they can work towards achieving recovery. We also offer case management services, which is linking to maybe benefits in the community or getting health insurance or other needs. And then we also offer additional supportive services in the community. So whether it's building skills so that they can achieve independence in their life. So in our outpatient clinic, we really try to provide a holistic approach to care for individuals that often are functioning relatively well in life. This is our lowest level of care. Oftentimes it's once a week psychotherapy and then maybe 2 to 3 hours a month of case management services. In our intensive case management team, we call it the ICM team, we have individuals that struggle with oftentimes a diagnosable mental health disorder, whether it's schizophrenia, bipolar disorder, major depression, and are really struggling with activities of daily living, are really struggling with maybe maintaining a job or struggling with finding housing or really not having the community connections that they need, and are often engaging with police or the Department of Corrections and jail or other individuals in the community, so they have the higher level of needs. And so because of that, we have case managers and we have counselors that go into the community 75% of the time to provide those services in the community to help them achieve recovery. So within the continuum of care, the ACT team, which is the Assertive Community Treatment Team, is really for the individuals that maybe haven't been as successful in achieving recovery in our outpatient clinic or on our intensive case management team. So this is really a step up. This is medically monitored, non-residential treatment, which means we have a nurse going out to help them take their medications. They're often engaged in more psychiatric services, so they're meeting with a medication provider to be able to get the meds they need up to 5 hours a month, which is quite a bit more than our other services. Individuals on the ACT team oftentimes are receiving between 5 to 10 hours a week of treatment services. So that's case management, that's support in finding housing, substance abuse services or counseling. The ACT team is designed to help the individual stabilize so that they can eventually step down to a lower level of care. Adult mental health residential treatment at Alaska Behavioral Health is a new service that we're providing. It's our highest level of care currently. It provides 24 hours, 7-day a week, medically monitored residential treatment to individuals that are really struggling with a mental health disorder, schizophrenia, bipolar disorder, major depression, that haven't been able to live safely in the community. Oftentimes, they're unable to function well, aren't able to work oftentimes, or have had lots of interactions with the Department of Corrections or have recently been in API. And so this is a treatment that we want to provide for individuals that can't maintain safely in the community. And so we're working with them to achieve that sense of stability. So we're providing medication administration so that they can begin to take their medication to begin to stabilize and reduce some of the symptoms. We're providing individual and group therapy so that they begin to learn those coping skills and learn ways to successfully engage with other individuals. We're providing budgeting support and case management with the ultimate goal that they'll be able to step down and to live independently in their own homes, in maybe an assisted living home with additional outpatient or intensive community support. In addition to the treatment services that we provide at the adult mental health residential treatment, we also like to have fun. So the residents engage in cooking so they can build some of those life skills, but also they enjoy learning the recipes and engaging in that. Residents also like to participate in playing cards so that they can increase their ability to meaningfully communicate with other individuals and build up their social skills. So this is an opportunity for someone to live in a safe, monitored, supportive environment for them to be able to achieve recovery and then be able to step down to a lower level of care. Alaska Behavioral Health engages in outreach efforts to those in the community that are struggling with homelessness. Part of the goal of our program is to go into the camps, go into the shelters or the areas where individuals are, and to be able to establish relationships with them so that they can access what they need. Oftentimes, individuals need stable housing, they need to get linked to benefits, and they really need mental health services. And so our goal is to go into those places, to connect with them, and then to provide linkage to the services that they need in order to achieve stability. The goal is to really get them the right care that they need, and that may also be at another agency in the community. Alaska Behavioral Health is now providing mobile crisis services to the Fairbanks community as part of the wider Crisis Now initiative across the state. The importance of mobile crisis team is you're providing the right care at the right time. And it's so important to do that because when you're missing the crisis component of care, what ends up happening is individuals don't get the care in the moment of crisis and the crisis continues to escalate, therefore leading people to maybe be admitted into the psychiatric hospital or to be arrested. Now our crisis clinician and our peer support specialist can meet them in that moment of crisis, whether it's in school or at work or in their home, and connect with them, assess what the needs are, assess for safety, and then be able to partner with that individual to either keep them in the community but link them to the needed mental health services, or to be able to work with them to achieve a higher level of care, but to be able to go voluntarily. There are other times where an individual is in crisis, and so first responders, whether it's EMS or police, also need to be there to meaningfully connect with that individual and provide a safe alternative and to de-escalate the crisis that's occurring in their life. In order to access services in the adult continuum at Alaska Behavioral Health, all someone needs to do is give us a call. Once an individual calls, within 1 to 2 days, we can usually offer an appointment. We also offer same-day crisis walk-in appointments. So if someone needs to be seen today, then they can just walk into our clinic and let the front desk know that they need to be seen today. When someone does come for an intake appointment, they meet with a clinician, and the clinician will ask them about their work history, we'll talk to them about their mental health, we'll ask them about their relationships and their housing. And then after that, what we call a mental health assessment, then we decide in collaboration with the client what level of care they really need, whether it's an outpatient level of care or intensive case management, or even some we've received referrals to adult mental health residential treatment. So depending on the client's needs and what they're wanting to engage with, the level of treatment, then we provide that linkage right from intake to the appropriate service.